This is Doc Handal, and welcome to Listen Up. Today I want to talk about bladder infections, recurrent urinary tract infections as well. We call them UTIs. You're familiar with the term bladder infection. It occurs across everyone, young, men, women, and especially the elderly. Now, many factors contribute to us ending up with one. Frequently, not enough fluid intake, sexual intercourse, menopause with the urethra mucosa and the vaginal mucosa being dry, and commonly, especially in children, contamination from the rectum. That is, after a bowel movement, the stool may get near the urethra. Now remember, the urethra is where the common tube from the bladder where the urine comes out. Okay? Remember, a urinary tract system is in the kidneys where urine is made or filtered, comes down the ureters, two of them, they hook into the bladder, and it comes down through one urethra. Okay? Now, in the women, it's very close to the vagina. In male, it comes through the shaft of the penis. Now, oftentimes people are immunocompromised, such as diabetics, people on medication or suppressants, people who have stones, kidney stones, people who develop many infections and antibiotics don't kill it. They get resistant strands of bacteria. Now, again, these are bacteria that cause these infections. It's not viruses. Now, what do you do when you get one? Well, you go get help because you know it's tremendously uncomfortable. And there are plenty of wives' tales, but the talk today is going to be about common tests, and more importantly, my focus always is prevention and what you personally can do. You start with the symptoms. Frequency, that is rushing to the bathroom, urinating a little at a time, maybe some burning, maybe some blood tinged in the toilet bowl. Remember that one little drop of blood can make the whole toilet bowl look like it has a lot of blood. Now, you go and get tested. A urine sample is given. When you give the urine sample, whether male or female, they're going to ask you to clean the area around the urethra, collect the specimen, the sample, in a container without dirtying the container. Keep the container sterile. Nothing gets inside of it. And catching the urine in the middle of a stream. Okay, that's called a clean catch specimen. Now, the urine will be dipped, as we say in medicine, with a dipstick. You probably have seen them use these sticks. Now, these sticks have like 10 different items that it checks for. It waits anywhere from 30 seconds to a minute to 2 minutes, according to what the stick is testing for in the urine sample. Now, there is one specific indicator on this stick for leukocytes, that is white blood cells in the urine. Okay, now if it is positive for leukocytes, you'll be suspected of having a urinary tract infection, and the specimen will be sent for culture and sensitivity. The culture part is to check out if bacteria grow, the sensitivity to see what antibiotic will kill that bacteria. Now, if you have frequent problems or complicating problems, for example, you have one kidney, you have diabetes, you're undergoing chemotherapy or HIV therapy, you may get certain studies, which include imaging, urinary tract studies, that will show if there's a stone. The physician may use a camera and look into your bladder, and that's called a cystoscopy test, and or cancer, God forbid, growing. Also, urodynamic bladder testing can be done. That is, if your bladder doesn't squeeze down, your bladder's a muscle, doesn't squeeze down totally, urine's going to sit there, and then infection can occur much more easily. So, incomplete emptying, dysfunction with voiding from previous surgery perhaps, or scarring from surgery could be identified with the urodynamic bladder test. Now, to prevention, what you can do. Well, they give you the appropriate antibiotic if you have an infection, based on the culture, as I just said, which can take up to 2 days to get. So, I want you to take antibiotics as directed. Some people who get frequent urinary tract infections, especially the elderly, they are on low-dose prophylactic antibiotic therapy for months at a time, and they usually take that in the evening. Now, for women who are postmenopausal, estrogen vaginal cream is often prescribed to improve the mucosa, that is the fine red tissue around the urethra and the vagina. Another preventive measure, easy, over the counter, is cranberry tablets to take twice a day. Another one, over the counter, is a probiotic, especially if you're on antibiotics, and that is a line lactobacillus or a heck of a lot of plain yogurt. While you're having yogurt, please do low fat. The other is D-mannose. A certain type of sugar, there's alpha and beta sugars, by the way, but this sugar actually can coat the bladder so that bacteria doesn't stick to the bladder wall. And this is taken usually twice a day as a preventive measure. Now, one of the biggest preventive measures, and I think I mentioned it earlier in children, but it can occur in females especially, and maybe that's why women have the highest incidence of bladder infections, and that is the manner in which we wipe ourselves after we have a bowel movement, or as a BM when you pass stool, that is. Now, sometimes women will wipe themselves and bring the tissue forward to see if they're finally clean after the bowel movement. That is not the best thing to do. Actually, you should not do it at all. You should wipe and drop. Don't bring forward to check. Use your judgment. If you have to stand up and look in the toilet for the last piece of tissue and was it clean, do so. You cannot. If you can't bring it forward, do not bring it forward. Bring it back from your rectum back out and then look versus bringing it forward. Some women have limitation due to spine problems or stature and size and are unable to inspect the tissue to be sure their rectal area is clean. And that's very important, to have your rectal area clean. I hope this podcast has helped you gain some insight into that whole issue of urinary tract and bladder infections, and hopefully preventive measures will make a difference for you. This is Doc Handal, and thanks for listening up.